This is Radio Entrepreneurs, and we're airing on any smartphone anytime you want. Just type in Radio Entrepreneurs, and you can get our app. People are doing it every day, which makes us, pretty happy over here at the studios for Radio Entrepreneurs. And our next guest is Sumit Nagpal of Lumira USA. Did I get it okay?
You did.
Whew. So why don't you tell us about Lumira?
Lumira is, we founded Lumira to focus on a part of the healthcare problem that's all about helping patients, especially those with chronic conditions, become self-determining under the supervision with the help of their physicians and their care teams. So it's really about giving patients the information and the support that they need so that they become much more autonomous in managing their own chronic conditions.
So is this in-home independent care?
It's really across the continuum.
Uh-huh.
We provide solutions that go into doctors' offices, solutions that tie them together with their patients who have these conditions, give them information about what's happening with their patients' conditions. We also go into the home with both software that runs on your iPhones and on the web, and also diagnostics, just really groundbreaking personal diagnostics, where you can do things, you can test things at home that previously you had to go to a doctor's office for, or you had to send out to a major lab. Some fairly groundbreaking stuff. And all of that is so that you can test frequently enough and monitor your own condition, and then respond accordingly with the support of your care team. So it's really surround you with information, surround you with the people who can help you understand that information, and really help you on your journey from having an out of control chronic condition to a place where you become free living and self-supporting. I got very interested in technology, and my initial goal was to marry the two. But when I was in school, this was in the early days of personal computers, I wound up running into a lab that was just a computer science lab that was filled with these beautiful, gorgeous black machines from Next. And I absolutely fell in love with those. Spent a bunch of time building a business around Next. Wound up working with Steve Jobs. Really went on and landed a bunch of accounts for Next, and worked with Next customers for a few years, and then really combined that passion, my passion for technology, with healthcare,
Mm-hmm.
and started building my first electronic health record in this very city, at what used to be New England Medical Center back then,
Right.
which is tough to know. So that's where we built version 1 of our software. Even though there's been a focus or talk about usability, no one's yet built systems for physicians that work just the way an iPhone would work, or just the way any other consumer electronic device would work, where you just use it and the technology isn't getting your attention. You're able to go get your work done with the technology. Healthcare has a lot of catching up to do, and that's a part of what we're doing.
So you're saying there are other companies in the field. It is competitive, but they're not really bringing out a comparable product.
What's unique about us is that we've assembled all of this under one roof into one completely integrated ecosystem, and that's really quite important for adoption. When you look at what are called walled gardens with Apple and even in some of the Android environments, the usability of a single, completely integrated solution, where the solution just works, and you get on with your life, and you do the stuff that you need to do without the technology, without having to struggle with the technology, that's very hard to achieve.